is Diógenes Sánchez, and I'm gonna be talking about what is radiology. Radiology is the medical specialty that uses medical imaging to diagnose diseases and guide their treatment within the bodies of humans, any other animal. It began by radiography, which is why its name has a root referring to radiation. But today, it includes all different kind of imaging modalities, such as non-ionizing electromagnetic radiation, such as ultrasonography or magnetic resonance imaging, as well as others that do, such as computer tomography, fluoroscopy, and nuclear medicine. Doctors who specialize in radiology are called radiologists, and radiology may be divided into two different areas, which are diagnostic radiology and interventional radiology. So, diagnostic radiology helps healthcare providers to see structures inside your body. Doctors that specialize in the interpretation of these images are called diagnostic radiologists. Using the diagnostic images, the radiologist or any other health provider can often do three things, which are number one, diagnose the cause of your symptoms. Number two, monitor how well your body is responding to a treatment you are receiving for your disease or your condition. And number three, screen for different illnesses such as breast cancer, colon cancer, or heart disease. Interventional radiologists are doctors that use imaging such as CT, ultrasound, MRI, or fluoroscopy to help guide procedures. The imaging is helpful to the doctors when inserting catheters, wires, or any other small instrument and tool into your body. This typically allows for smaller incisions or smaller cuts. Providers can use this technology to detect or treat conditions in almost any part of your body, instead of using larger incisions and directly looking inside of your body through a scope, a camera, or by open surgery. Interventional radiologists often are involved in treating cancer or tumors, blockages in the arteries, veins, fibroids in the uterus or the womb, back pain, liver problems, or kidney problems. Examples of interventional radiology procedures include angiography or angioplasty of stent and stent placements, embolization to control bleeding, cancer treatment including tumor embolization using chemoembolization or Y90 radioembolization, which is for a form of breast biopsy guided either by stereotactic or ultrasound techniques. Now, what is an X-ray? An X-ray is a quick, painless test that captures images of the structures inside your body, particularly the bones. X-ray beams pass through the body. These beams are absorbed in different amounts depending on the density of the material they are passing through. For example, dense materials such as bone and metal show up as white on X-rays, but the air, the lungs show up as black, and the fat and the muscle appear as shade of gray. For example, in these two pictures, we can see what is an X-ray of the chest, and in the right and the left images is a chest. And we can see, for example, the left picture show the heart and the lungs, and in the picture of the right side, we can see a mass in the right lung, which is color white and is next to the heart. A computerized tomography scan, also known as a computerized tomography scan, also known as CT scan, is a type of imaging that uses X-ray techniques to create detailed images of the body. It then uses a computer to create cross-sectional images, also called slices, of the bones, blood vessels, and soft tissues inside the body. CT scan images show more detail than plain X-rays can do. A CT scan has many uses. It's used to diagnose diseases or injuries, as well as to plan medical, surgical, or radiation treatment in the case of cancer, for example, or any other kind of tumor. In the picture, for example, we can see what is a tumor in the brain, in the left side, and in the right side, in the upper part of the picture, we can see what is the actual CT scan machine and the patient that is lying inside the machine.
Hi, my name is Encarnación, and I will be talking about the terminology and vocabulary of medical imaging. First, we have X-rays. An X-ray is a type of radiation that is used to create images of the inside of the body. X-rays are often used to image bones and teeth, but they can also be used to image other organs and tissues. Next, we have computed tomography, or the common name is CT scan. A CT scan is a type of X-ray that uses a computer to create detailed images of the inside of the body. CT scans are often used to image bones, muscles, blood vessels, and other soft tissues. Next, we have magnetic resonance imaging, MRI. Is a type of imaging that uses magnetic fields and radio waves to create detailed images of the inside of the body. MRIs are often used to image the brain, spinal cord, and other soft tissues. Then we have an ultrasound. This is a type of imaging that uses a sound waves to create images of the inside of the body. Ultrasounds are often used to image the heart, kidneys, and other organs, especially or commonly used on pregnant women. Next, we have nuclear medicine. Is a type of imaging that uses radioactive substances to create images of the inside of the body. Nuclear medicine scans are often used to image bones, organs, and tumors. We have a mammogram. Uh, these are specific terms. A mammogram is an X-ray of the image of the breast. This is used for testing breast cancer. And we have a CT angiogram, is a CT scan of the blood vessels.
Hi, my name is Perla Reyes. Medical imaging refers to several different technologies that are used to view the human body in order to diagnose, monitor, or treat medical conditions. Each type of technology gives different information about the area of the body being studied or treated, relate to possible disease, injury, or the effectiveness of medical treatment. The most common types of diagnostic medical imaging include computed tomography (CT), also known as computed axial tomography (CAT), scan include CT angiography, fluoroscopy, including upper GE and barium enema. Majestic recent images, MRI, and magnetic recent tomographic, MRA. mammography, nuclear medicine, which included such tests as bone scan, tray scan, and Thailand cardiac stress tests. Plain X-rays, which included chest X-ray, positron emission technology, also called PET imaging, PET scan, or PST, when it is combined with ST and ultrasound. Thank you.
I'm Karla Martínez and we'll be talking about nuclear medicine. Nuclear medicine is a specialized area of radiology. It uses very small amounts of radioactive substance, radionuclide, or radiotracer for health research, diagnosis, and treatment of various conditions, including cancer. Nuclear medicine imaging is a mix of many different disciplines. This includes chemistry, physics, mathematics, computer technology, and medicine. Nuclear imaging shows organ and tissue structure as well as function. The extent to which a radionuclide is absorbed or taken up by a certain organ or tissue may even show how well the organ or tissue is working. So, while diagnostic X-rays are used mainly to study anatomy, nuclear imaging is used to study organ and tissue function. The areas where the radionuclide collects in greater amounts are called hotspots, and the areas that not absorb the radionuclide are called cold spots. These look less bright on the scan image. PET scan. A positron emission tomography (PET scan) is an imaging test that can help reveal the metabolic or biochemical function of your tissues and organs. The PET scan uses a radioactive drug called a tracer to show both atypical and atypical metabolic activity. A PET scan can often detect the atypical metabolism of the tracer in diseases before the disease shows up on other imaging tests, such as a computerized tomography and magnetic resonance imaging (MRI). A PET scan is an effective way to help discover a variety of conditions including cancer, heart disease, and brain disorders. Your healthcare provider can use this information to help diagnose, monitor, and treat your condition. In case of cancer, cancer cells shows up as bright spots on PET scans because they have a higher metabolic rate than do atypical cells. PET scan may be useful in detecting cancer, revealing whether your cancer has spread, checking whether a cancer treatment is working, and finding a cancer recurrence.
Hi, my name is Yadari Méndez. Magnetic resonance immunology. Magnetic resonance field and computer-generated radio waves to create the lethal immunology of organs and tissues in the body. Most MRI matches are large and liberal space market. When you are leading MCIT and mirror matches, worldwide radio, gaps and heat drops atoms in your body to create crops retinal immunology, like swill of bread. The mirror matches can also produce 3D immunology that can be read from different angles. With this done, Mary is a monograph way for the healthcare professional to examine its organs, tissues, and the skeletal systems. It products high resonance immunology of the inside of the body to help diagnostic various conditions. It is usually used to diagnose the following: aneurysms of the vessel of the brain, AF and inner ear conditions, multiple sclerosis, sclerosis, spinal cord conditions, stroke traumas, brain injuries from traumas. Rights. Because Mary Epps' strong manage the presence of mental on your body can be a safest hazard if you are attracted of the magnet, even if they are not attracted to the magnet. Metal objects can distort memory, immunology. Before you have married, you because you have married, you like um, you like if of fill out a questionnaire where you mention a Werner, you have metal or electricity defections, the deficiencies in your body.
Good morning, my name is Sorainy Andújar, and I'm going to be talking about sonography. Diagnostic ultrasound uses sound waves to make pictures of the body. Ultrasound, also called sonography, shows the structures inside the body. The images can help guide diagnosis and treatment for many diseases and conditions. Most ultrasound are done using a device outside the body. However, some involve placing a small device inside the body. Why is done? Ultrasound is used for many reasons, including to view the uterus in a body during pregnancy and monitor the developing baby's health, diagnose gallbladder disease, evaluate blood flow, guide a needle for biopsy or tumor treatment, examine a breast lump, check the thyroid gland, find genital and prostate problems, assess joint inflammation called synovitis, evaluate metabolic bone disease. Risk. Diagnostic ultrasound is a size procedure that uses low-power sound waves. There are no known risks. Ultrasound has a value tool, but it has limitations. Some waves don't travel well through air or bone. This means ultrasound isn't effective at imaging body parts that have gaps in there or are hidden by bones, such as the lungs or head. Ultrasound also may not be able to see objects that are located very deep in the human body. To view this area, your healthcare professional may order other imaging tests such as CT or MRI scan or X-ray. There are some examples of sonography. There is transesophageal echocardiogram. A transducer inserted into the esophagus obtains hair images is usually done while under sedation. Transrectal ultrasound. This test creates imaging of the prostate by placing a special transducer into the rectum. Transvaginal ultrasound. A special transducer is inserted into the vagina to look at the uterus and the ovaries.